It's funny how so many people are bothered by their jowls, and they'll say, you know, I don't mind being 50 or 45, but I don't want to be 45 with jowls. And so they said, this looks like my mother or my father or something like this, because some people inherit that and they just want to get rid of these. But as people are looking now for minimally invasive procedures, you have to be very careful. I had an example of a patient who came to our front door, and she had her hair all down like this, and she wanted to see me about something, but she didn't want to say what it was, and she was hiding scars from a surgeon who had taken out her jowls and just cut across here, removed the jowls, and left scars on both sides. And they're there forever. And this poor woman is 48 years old, and she's got facial scars that cannot be taken care of. So what you have to do is make sure that you have a very good surgeon to take care of a problem like this. And then the jowls can be contoured, removed. What we use is a lifting procedure that's an extended inner lift. So it's done at multiple layers rather than just try to stretch the skin, because that gives way too fast. So what we try to do is bring up this tissue, get rid of the jowl area. And we also look at the chin region, because oftentimes people will have areas of deflation. Just at the side of the chin, in front of the jowl, these areas start getting more and more deflated, and as they become deflated, the chin looks bigger. People will say, I've got an old lady chin and I'm young, what's going on? So we fill in with fat in these regions to help give a smooth jawline, and sometimes back in this area as well, behind the jowl, we'll fill in and try to give a beautiful contour to this angle of the mandible, as we call it, and that's particularly common in men who want to look more masculine and they feel like they've deflated, so we can give them a nice jawline with their own fat. Rather than any plastic or any synthetic material that might get infected, if you use your own fat, you've got your cells, your own stem cells, and your own blood supply that helps keep this fat alive. We've done this on young people who want to have more chin, and so we put in fat along the chin area, maybe liposuction a little bit in the neck region, perhaps a rhinoplasty at the same time, to try to give a more artistic appearance to their lower face so it matches the other very nice features of their upper face. And so it's all about artistic balance. And the jawline is a region where we can help people of all different kinds of ages through sometimes very minimal procedures, sometimes procedures that are more extensive and involve incisions where we are removing skin at the same time, but certainly at a place where we are repositioning tissue to bring it up and get this gravity problem where it just continues to fall with time, and we bring it up, and we bring it up to the areas where they may have lost, such as cheekbone areas, and people say, you know, I lost my cheekbones, but now it's all down here in my jowls. We actually bring that same tissue up and with permanent stitches, put it back up and recontour and reshape to bring out beautiful cheekbones, which is really their own tissue, and rather than any cheek implants or things like this, and it gives a very nice jawline with a balanced face that's no longer square, but a more oval shape. And that tends to be very enhancing and giving them a natural look that looks youthful. So when they bring in pictures of what they look like at 20, 22, 25, it's so helpful for me to see what it looks like. Now, I operate on a lot of people from out of the country, and I look at ethnicities as well. And people who come to me who are various Asians. I've had a number of people come from Korea where they want to make sure that they're not too full up in this region. So when we're lifting this tissue up, we don't make even bigger cheekbones. So you can very much tailor it to what the person wants. Or we've had some people from Poland who said, you know, I feel like I have a very small lower face, but I'm too cheeky. So we can augment the lower face through fat injections and through lifting, and then decrease that part of the upper face that's a problem.